Hey, Jeff here. Now, time for another Clean Start weight loss program. And the question is, what is the lifestyle program and how is it different from the maintenance program? Again, very good question. I know we covered a lot of items when we were at the symposium, and so this is one area that does get confused. Now, the 6 weeks maintenance program is part of the HCG program. So you do the 23 to 43 days of the HCG, you take your 3 days off, no HCG, but you continue the diet, and then you do 6 weeks of maintenance. First 3 weeks, no sugar, no starch, but you can protein and carb up as far as carbs and vegetables go, so all the vegetables and protein that you want. And then the second 3 weeks, you slowly add 1 starch a day until you can see what you're sensitive to. And so that's the maintenance program. It's included in the program. We charge $10.99. You may charge $8.99, $9.99, but that 6 weeks maintenance is included in there. That's a big selling point as well, because your competition isn't going to include the 6 weeks. So you don't say, yeah, I have a 43-day program. No, you say you have a 90-day program because you just added 4 more weeks of program. And don't underestimate that maintenance program. Now, the lifestyle program actually starts after the very end of the 6 weeks of maintenance. So at that point, what we do is we charge $99 a month, and it's basically a come in as you want. And if you remember, this was kind of the slide, and this is like a way to do that. So what we did is we charge $99 a month. They have a monthly checkup. So we have a BIA scale. So whether they go on it once or 100 times doesn't cost us anything, so they can have it. So we'll put them on the scale, we'll give them a print off, and away they go. We have an RMR as well, but we do not include that here. We maybe give it once a year because your RMR really doesn't change that much, so it's not really needed. We also give them the Clean Start weight loss guidebook. Okay, so this is the book that is the non-HCG book, right? It's the one that has the picture of the weights on it. So there have weight exercises, there's more recipes, there's a food journal, there's all that great stuff is inside that book, as well as lots of things like more information about sugars and carbs and proteins and all that stuff. So that's all in there as well. So they get that book. And then as well, we give them a monthly lipotropic or a B complex injection. So it really depends on what they want. A lot of people want this fat burner injection, and that's the lipotropic, the MIC injection, which is what we covered on the Friday. So we'll give them that. It's probably not going to do a lot for them. The B complex is actually a way better, and they cost the clinic about the same price for either one. It doesn't really matter. So our price and the price to the patient is nothing. So they come in, they get they get one of those injections whenever they want. That's a nice thing about having a medically supervised weight loss program, right? You usually have a nurse or someone who can do IM injections so they can do those. So the biggest reason we found is people signed up for this is they want that accountability, right? So if you have like a monthly email program through maybe a program like Constant Contact where you just email them, maybe your EMR has a monthly newsletter, give them some tips. The big thing they want though is they'll come in for that injection, and those injections take 5 minutes, so they can come in whenever they want, get the injection, and away they go. These add up to a lot. You have 10 patients paying you $9.99 a month. That's $1,000 a month. That's $12,000 a year, and you're not doing an awful lot for that, and you're helping the patient stay on. That's one of the reasons Weight Watchers is so successful. They have this check-in. This is like a check-in. You can also go in and bring in a personal trainer, a dietitian, and expand it however you want. I've personally found those don't work very well, but I like doing that. But when no one shows up, it's kind of a sad thing. So the $99 lifestyle, do not underestimate this. You get 100 patients in a couple of years paying you, thousands of dollars a month. $50, $60, $100, $150,000 a year. This adds up to a serious part of your practice's profits and revenue. So don't not do the lifestyle program. Hopefully that better understands the lifestyle program versus the maintenance program on the HCG program. Have a good day.